volunteer, donate, or use the service, how should they contact?
Well, we have a great contact through our website at www.csrp.ca, and on that there is an info@csrp.ca that people can submit emails to. We've also got a telephone number that is located on the website that people can call through and leave a message. So, and we will respond as soon as we can. So that's a great contact site. It also keeps people up to date on our local events that are going on. It also has a copy of our first published Cancer Support Resource booklet publication as well. So
thank you for that. That's awesome. Do you have any stories, like obviously not using names and things like that, but any particular story that you would like to share that highlights some of the things you've done?
Well, I think there's a number of golf tournaments that have been really profound in that a lot of people have been very generous to raise money and donate it to certain needy people in the area, and it's been fantastic to see that these people have received that benefit and are applying that. We also launched a new program through the George's Night Out. We brought all the local people that had been diagnosed or family members out to a free afternoon at the Strand Theatre locally in Simcoe, so for a movie just before Christmas. And we're hoping to make that a yearly event too, so it's a chance to come out, enjoy a show, and really enjoy some time with other people that are in a similar situation. So.
That's awesome. Congratulations. I love hearing about stuff like that. You mentioned that you had resources for people when they first receive a diagnosis. Do you have any suggestions to the audience, maybe if they're not in Norfolk County? What are some of the things that when you first receive a terminal diagnosis or something that's really major, any suggestions for that moment in your life?
Well, I think one has to look at the quality of life, the perspective that the doctor is giving them from their side of medicine as well. And I would always recommend that there is perhaps a second opinion that can be taken, whether it be from a naturopathic doctor or perhaps another oncologist or another medical doctor. I think that naturopathic doctors will look at pathology or diagnosis in a very different way. And it depends on goals and outcomes. Quite often diagnoses are made with a certain set of criteria, but if you look at the body holistically and you look at other methods of treatment, there are many other options out there. So although it may be a terminal diagnosis, it may mean that the rest of the time that you do have to spend could be lived in a very high level of quality and comfort and an enjoyable time, as opposed to really suffering and feeling a lot of pain. And that's more so from a cancer perspective that I'm talking about. But there are many diagnoses that naturopathic medicine will look at from a different way, using different testing, different angles, and find a root cause as to what's going on. And if a patient is able and willing to apply themselves through dietary changes or through other profound changes in their lifestyle, their nutrition, they can really turn things around quite a bit. So.
That's fantastic. Now, you've also mentioned in their support for the caregivers, and that's something that I really hope to highlight here, because I know with myself, when someone I care about is going through something, I can almost feel it myself. And do you have any advice for people that are the person at home caring?
Well, it comes a very big challenge, and a lot of the time the caregiver is forgotten in the whole process of diagnosis and disease management, and that they are quite often the people that have to help that person through and spend a lot of time, and they're forgotten. So I think you have to really keep in mind that you have to keep yourself healthy as well, and it's a coordinated effort, and to work alongside with that is a very important thing. So quite often we will treat our caregiving partners as well as the person that's been diagnosed with perhaps a pathology, per se, from the Western perspective. So it's a very essential thing, and it's a good thing you mentioned that too. There are other organizations locally that can help out with that. There's the Caregiver Wellness Center. It's partnered with the Alzheimer's Society, and that's been around for the last 15 years. And that's where actually the CSRP has moved to, so it's a very good resource hub in itself, to be able to find a lot of these resources for caregivers that are seeking for extra assurance. There are courses that are put on, there are trained nurses and professionals that will actually give support through that, so that we can make that journey that much easier and that much more effective for both the patient and the caregiver. That's
fantastic. I wanted to just bring in something that's really prevalent in my life now. I'd like to ask you to speak about allergies. Now, when I met Dr. Armstrong a few years ago, I think some of the first words out of my mouth were, "I think I'm dying." I had so many different issues coming through, and I'm going to do a special on allergies in itself, but I just wanted to bring it up quickly today because it's such a prevalent thing for me, and I think a lot of people think of food allergies as digestive issues, you know, maybe mouth sores, anywhere the food touches, you know, gastric issues, bowel issues. But I was wondering if you could just throw out there some of the symptoms that you can develop from food allergies.
Okay, first I'll just explain there's two main streams that naturopathic doctors and Western medical doctors can test for. The first is an anaphylactic type of reaction. It's called an IgE-mediated allergy, and that's an acute anaphylactic reaction where you'll develop hives on the skin. You can actually develop swelling in the throat and constriction, or perhaps it can even progress if it's severe enough to a heart attack. So those type of allergies are an acute onset. They will occur within seconds of having contact with the allergen and will usually present within the first hour of having contact. So you pretty much know you have those allergies if you have them. Typically I don't test for those a lot of the time because of the knowledge and that correlation. The type of allergies I test for are delayed hypersensitivity allergies. They're an IgG-based allergy, a different subset of the immune system. And what happens is the immune system produces certain proteins in reaction to certain foods or airborne allergens, and these can be of a delayed onset. So it could be 2 to 3 days after contact with the allergen that your body actually creates symptoms. And the symptoms that we quite often develop to these type of allergies are recurrent ear, nose, and throat infections, a lot of inflammation in the digestive tract, which then translates out to the joints and causes a lot of arthritic, or exacerbates a lot of arthritic, rheumatoid and osteoarthritic symptoms. It can cause a lot of GI distress, as Amy had mentioned, a lot of gas, bloating, discomfort, slower bowels, so constipation or diarrhea, or alternating bowel function in that sense, intermittent chronic bowel constipation or diarrhea. And the other thing that can also occur are a lot of hyperactivity symptoms, depression, anxiety, a lot of facts that, or side effects that people would never relate to food allergies. So when I see a lot of hyperactivity in children, that's the first thing I think about when I see a diagnosis of ADHD. It is a classic diagnosis for the symptom pictures at hand, but when I think of things as a naturopathic doctor, I figure what could be causing these symptoms as opposed to just treating and palliating the symptoms and covering them over. So instead of using a pharmacological dosing of a stimulant that will help to suppress these children and keep them quiet, what I will do is I'll try and do these food allergies to try and figure out what's going on with the children, what foods could be removed from the diet that may actually be creating these habits and these reactions and these this lack of focus, this hyperactivity. So
is that actually true? Because I have heard that both autism and ADHD, that food allergies can be a cause. Is that true?
There's a huge link, and I would say that it's one of the causes, and when we have to look at both of those conditions, it's usually a multifactorial approach. Right. So a lot of people do say that food allergies can be a huge link. Well, it's definitely true. I would say that in my practice there hasn't been one child that I have seen that has been diagnosed with either ADHD or autism that hasn't had some type of food allergy. So it's a prevalent thing, and just to put it under another perspective, a lot of people out there do have some food allergies. It's just a matter of finding out how severe that allergy is and how effective it is on their quality of life as well.